Happy Friday. Good morning. So excited about our speaker and our discussion this morning, which is focused on advanced care planning efforts across the state. So timely because we have National Healthcare Decision Day coming up this Sunday. Real quick to that point, we do have some great information and resources on our website related to advanced care planning, which I encourage everyone to check out if you haven't already. And I'll make sure that I put that link in the chat here in just a moment. Also, just a reminder that our monthly meeting is 1 week from today at 11. So please mark your calendars and join us for that. And outside of that, post any questions you have along the way. And it's my true pleasure and honor to get to interview my friend and colleague, Marisette Hasan. Marisette has been a member of our coalition for quite some time. And in South Carolina, she has led the Coalition for the Care of the Seriously Ill. She served as the president and CEO of the Carolina Center for Hospice and End-of-Life Care. She wears many, many hats, which I know she's going to share all of that with us this morning. But specifically, we'll be talking about the outreach work being done for advanced care planning in African-American churches across the country. And in particular, what's being done here in North Carolina. So before we get to that, Marisette, I think it would be great for everyone who may not have a good feel for you to just learn a little bit more about you and who you are and what shaped you and what's really inspired you to have this passion for advanced care planning.
Oh, wow. Well, good morning, everyone, to the coalition members. Many of you I do know, and my cadence has been off a little bit this year, getting on with some of our calls due to just some transitions this year. But it's so good to be with you guys today. My background is in nursing. This year, I've been a nurse for 41 plus, 42 years this year. It's hard to believe that the time has gone by so fast, right? I remember being a new graduate back in 1981. And at that time, they had a program, which was an externship kind of program for new nurses to rotate 3 units. And the very first unit I was on was the cancer unit. Oh my gosh, it changed my life to work with oncology patients. I had the most amazing mentor, Shirley Jeter, and I learned what it was like. So often people think that patients are asleep at night, right, in the middle of the night. So nurses on the night shift couldn't possibly be working hard. But I'm telling you what, we were in the midst of doing a lot at night, not as many staff. And I learned how to not just only care for the patient, but also care for their environment, to listen at the bedside. Many times patients were awake in the middle of the night and they had things that were worrying them. And also, as a nurse with a strong faith tradition, I would sometimes have opportunities to pray with my patients in the middle of the night. And so that has begun my journey. Yes, Sue. And so my journey began working on that first unit, so much to the point that I went to the psych ward. It was not what I thought it was going to be. I thought I was going to be doing counseling and they wanted me to push pills. So that I didn't want to stay there. And then I was on the med surge unit, which was fine. But the cancer unit grabbed my heart and ultimately led me into hospice. I have had a very full, rich career working not only with patients and families, but in the later years of my career as a senior executive leader with the Hospice Association, the Carolina Center. I've been privileged to do public policy, to work on regulatory issues, to train providers. And in the math of COVID, I've been doing a lot in terms of serious illness care and health equity and working with some of our national leaders with some of that, such as NHPCO and CTAC, Ariadne Labs, et cetera. So when I'm not working, I am a wife and a mother. So I am excited about my role as a wife, but even more excited as a mom, right? I think that mom role sometimes overtakes the wife role. And I have 2 children. Our son, BJ Bernard II, is graduating from Winthrop University with a degree in international business on May the 6th. And our daughter, Sarah, she's in North Carolina, where most of you guys are. She's at Duke, and she's a sophomore majoring in public policy. And we were just there Saturday. She just crossed over the burning sands. To those of you who are African American and you know about the sororities and fraternities, Sarah just crossed over to the prestigious Delta Sigma Theta sorority over there at Duke. And her mom, it was a first experience for me because I wasn't involved with Greek life when I was in college. So I really got an education at Duke on Saturday all day, and it was amazing to be there with her. So that's a little bit of my. I could go a lot deeper. Let me see if there's one other tidbit. Oh, I'm an ordained elder at my church. So everything that I'm involved in, my core is my faith. And I'm inspired to really touch people, to connect people. I find in this season of my career that I'm doing a lot of connections, that I'm connecting individuals and organizations to groups that can help them. And I'm just honored and privileged to be able to do that, along with a lot of our work that we're doing in the Carolinas. So I'll stop right there. And Virginia, did you have other questions for me?
I did, and that was a perfect pausing point referring to the Carolinas. Can we kind of talk a little bit, maybe starting at the national level, but then down to
Yeah.
here in North Carolina, just about the advanced care planning that's going on, this grassroots efforts and movements that I'm hearing about taking place within churches. You and I have had some conversations about it, but I think it'd be great just to
Yes.
learn and share a little bit more with the group about that.
Yes, I'd love to do that. About a year and a half ago, I became a board member for a national foundation called the John and Juana Harmon Foundation. And they are a family owned foundation that has done a lot of work in the serious illness care space. And their focus is really on African American communities. I met them through uh, uh, some work that was being done here in North Carolina with the Duke University. They have an African American Advanced Care Planning Network, and the Harmon Foundation funded some work for that particular network. So I was connected to the executive director through some of that work, and they reached out to me to serve as a new board member. Their work has really allowed them to do some interesting things in African American communities, particularly faith communities. There is a project that right now is going on in Alameda Care Alliance in California, where the churches have been trained, sort of a train the trainer program on how to conduct advanced care planning conversations, but also to conduct seminars and also to coordinate with caregivers as you think about the professional caregivers in those communities. So it's sort of a collaborative care coordination network with the base being the African American faith community. Another area where the Harmon Foundation has put some monies has been in Colorado with a program there with African American churches utilizing an amazing product by Dr. Gloria Anderson. She has a advanced care planning booklet called What Y'all Gonna Do With Me Now, a guide for advanced care planning for African Americans. And so Dr. Gloria Anderson, who also worked at NC State, has this amazing tool that the Harmon Foundation has funded for her to go into these communities and partner with individuals there. She's done this work in Kansas, and she's also done some work in Maryland with hospice organizations who wanted to do outreach into African American communities. Particularly Georgetown County is what I've heard that amazing work. Another area where there has been work in African American communities nationally has been in Boston. Dr. Gloria White Hammond, who's also a pediatrician and a pastor, does a program in her church. So we had her to come to Columbia, South Carolina, a few years during our project. And what her church was able to do with the AME churches there, they actually put on series, advanced care planning workshop series, like a three-part series in the church a couple times a year. And they utilize the Five Wishes booklet for that. And so they've also been engaged in doing a cultural tailoring of what matters most for clergy to be able to understand how to have these conversations. The neat thing about Dr. Gloria White Hammond's church is when they began doing these advanced care planning workshops, they have a congregation of probably 500 to 600. And through these workshops, they've been able to get more than 50% of the congregants to execute an advance directive. That's amazing, right? Where you have that many people, particularly in our communities where we really don't want to have these conversations. We have some myths around having these conversations about what's going to happen when we can no longer direct our care, who's going to be the person that's going to be in charge. And so I absolutely love, from these national examples, want to share with you that what seems to has worked is really having lay individuals as well as spiritual leaders who have influence with their congregations be out front with these types of trainings. So I know you want to know about what's happening in North Carolina, and I'm just jumping up and down on my seat to tell you that we are on the front line in the Carolinas, and especially in North Carolina. I'm currently doing some work with Dr. Kimberly Johnson there at Duke Health, and she's also a part of Duke University. And Dr. Johnson, about 5.5 years ago, received a large grant from PCARI, a national funder. PCARI is the Patient Care Outcome Research Institute that is in DC. And her grant was really to use community health workers. And the research intervention was to look at two different types of advanced care planning tools and to determine how those tools work for African Americans and for white Americans. We've recruited more than 800 patients during this. We didn't think we were going to get 400 African American patients to sign up, but we did that number in terms of our Black patients, and our white patients were almost at the halfway mark as well. The really innovative thing about this is that this particular project is being done in 5 states: Texas, Alabama, Georgia, North Carolina, and South Carolina, utilizing community health workers to execute an intervention with either respecting choices or 5 wishes. The community health workers have done amazing, amazing work with these patients, looking at patients in primary healthcare centers. And most of our work had to be done during COVID time. So we had to pivot from face-to-face interventions to doing this work virtually. And the community health workers were trained on how to do respecting choices. They reached out to patients that were screened and who were willing to participate. Half of the patients used 5 wishes, half of the patients had respecting choices. And I'm telling you what, it's been phenomenal. And you'll be hearing more about some of the results with that work. Another project that's being done in North Carolina is a project that's being done with the AME Zion churches, African Methodist Episcopal Zion churches in North Carolina, under the direction of Dr. Kimberly Johnson, and it's called Equal Space. And in this particular project, I'm so excited about it. There are a lot of advanced care planning tools and guides that are out there for trainings, everyone. But this particular group wanted to do something in particular around incorporating spiritual scriptures into the training materials. And so Dr. Johnson's group interviewed more than 610 of the congregants of these 17 churches and discovered, just like we know, that the majority of them said, hey, I've not had a conversation. Yes, I have not executed a document, and I'm not sure who I would want to put in place And many of them wanted information about hospice and palliative care, and they wanted to know about health disparities. And so, in going through that and the focus groups that Dr. Johnson did, they were really clear that they wanted a tool that would incorporate their faith traditions along with advanced care planning information. So we have crafted a curriculum. What I love about this is not only are the ministry health leaders going to be the facilitators, but the pastors of these 17 churches are also actively involved. I've had an opportunity to sit with these pastors. I've had an opportunity to help craft this curriculum. And so it was fun to do this because of my faith traditions, and then also having the medical piece, and to put those two pieces together has been really great. For example, utilizing a scripture that says, write the vision and make it plain, right? So an advanced directive is writing the vision. It is laying out for the people that you love what it is that you want to do. And the scripture says, though it tarry, wait for it will surely come. We know that death is going to come. And so the pastors, as we put the scriptures and wove it into the curriculum, absolutely love that. Another hallmark of this curriculum with these pastors is that they wanted to talk about how Jesus had an advanced directive. And looking at the life of Christ and how he prepared his disciples, how he prepared his mother and said, Mom, look at your son, John. John, look at your mother. How he began to walk them through what that process was going to look like before he was crucified. And of course, we're coming right out of Easter. And so we've woven in those kinds of scriptures so that the individuals will understand that this is a part of what undergirds them as a church, those spiritual principles. But advanced care planning is definitely scriptural. The other thing that they wanted to do was to be sure that we incorporated stories and testimonials. And so we're going to have an opportunity. I am now working with them on the Trainer series, and I've trained them on the first two modules, looking at what is advanced care planning, debunking the myths, what are the benefits, and then looking at our North Carolina directives, and then also having a time for them to share their stories. Many of them have had loved ones that have died. Many of them have had hospice. And so you have the ministry health leaders who will conduct these seminars, but the pastors are also doing sermons. And so when you can lead from the front as a pastor, right? You lead from the front and you are encouraging your parishioners to put their advanced care plans together, and they see that you're doing it. There's still a lot of influence that pastors have in our African American churches. So truly excited about that project. The churches are getting ready to roll out their workshops. So we're excited about that. And then we're doing some work with Health Sciences Innovation Group with churches as well. So Margaret and I and Virginia and Shane, this is part of the grant that we received a couple years back. And so we are actually going into churches, and it's just wonderful to see, because it's sort of a two-part seminar. They get to understand about advanced care planning, and then we're able to encourage them to upload their documents to our platform, which is Mind My Health. And so that is really going well in North Carolina as well. So even though I live in South Carolina, I'm hanging out with the North Carolina crew quite a bit. Oh my God, the time is going. I'll stop there, Virginia. Are there any questions?
Well, I just want to put a plug into what you were just saying, Marisette. For those of you who have not seen Marisette in action, I've had the pleasure of coming to some of her workshops for this grant that we have, and she is not only so engaging and passionate, but to the point you made a minute ago, Marisette, about getting people to tell their stories. I witnessed you really engaging everyone to share their stories, and each story hit home in a different way. It seems
Yes.
to really engage others, encourage them to participate. So I think that was a key point that you made as part of the work that's being done.
Mhm.
And, I'll just put in another plug. If anyone on this call is interested in hosting at your church or faith organization, one of these workshops, it's free. We come in, Marisette, like she said, does an amazing educational presentation. We bring a notary. Everyone can complete their directives at that point and upload them to Mind My Health. But that I'm just going to plug that in. If you're interested, let us know. Um, I did have some questions, Marisette. Is there any way that or any opportunities for our group to kind of support this work that's being done within the community? Are there other resources? You mentioned the five wishes and respecting choices, is
Mhm.
conversation project something that also falls into that?
Yes, yes. The Conversation Project has a wonderful tool for faith communities. It is really geared around faith communities. And what I love about the Conversation Project, it's open source. So you can put your own logo on it, you can download it, make copies, etc. So it works really well. You don't have to worry about having to pay for that as a resource. So that is really, really a great tool as well. And we use all of these different resources when we're out with doing the work with the churches. So the Conversation Project guides. Ariadne Labs has a tool called What Matters workbook that can also be downloaded. It's open sourced as well. So a lot of these different tools that you can utilize. Duke University, with their Duke Divinity School, they are the backbone and the host for the African American ACP network. And they now have a website, and I'll make sure I get that information to you, Virginia. And on their site, it is all kinds of things for African American churches. They have sermons on there. They have educational tools that people can utilize with their particular faith communities. And So you would find that also beneficial as well. And so that's pretty good. Heather wants to know, does anything surprise you when you do these workshops, like the myths? Well, we have this myth, and it's something that if you talk about dying, you're going to make it happen faster. And that just seems to come up all the time. That's something that we're having to debunk. That you know you want to plan ahead, and as it relates to scriptures, we talk about the scripture where the king is getting ready to go to war, and he has to count the cost. He has to put together all the tools, figure out what the budget is, and so when we talk with individuals, we talk with them about sometimes those stories or the testimonials talk about what happens when there's not a plan in place. When you show up at the emergency room and now the emotions are high because there's an acute medical emergency and no one knows what to do. So there have been people who have shared their stories about how difficult that was. And then on the other hand, those who've had situations where there was a plan, where their parents did lay out everything already, told them what to do. The funeral plans were already made. Another issue that comes up is life insurance that we're finding a lot in our community, people not having life insurance and doing GoFundMe. And so we even have a part of our curriculum for these AME Zion churches to talk about funeral estate planning and why GoFundMe is not a realistic option to cover for paying of funerals, because that's something that is occurring as well. So they really wanted something completely full to look at advanced care planning, to hear the spiritual perspective, to also what is hospice, what is palliative care. Many of them don't understand the difference, and we know that's pretty real for all groups. But talking about hospice and palliative care, and then funeral and estate planning, what does that look like? So I think I was so impressed with this particular group of churches because they really want to help their members in all aspects. So
Good question. Is there any other questions? I've got some questions, but I want to open it up to the group first to see if there's anything Anything else?
Oh, I love Harold's question. Interstate estates that can result from a lack of it. But yes, intergenerational transfer of wealth in Black communities, especially the problem of heirs. Yes, I'm one of those. I can testify to that. Not having a will and then things being tied up, and it's heirs property. It's what we call heirs property. We have some property like that my grandfather has back home in the low country of South Carolina, and it's not been resolved. And so who's paying the taxes on it? There are just all kinds of problems when we don't plan ahead. And we've seen a lot of that. So, Sue, you said, what's missing? What else would you like to see happen? What I would like to see, and the AME Zion churches do have some individuals who are health professionals in their group. But what I would like to see, this is sort of a different topic though, Sue, is I would love to see more diversity in the workforce. I feel like we are don't have the numbers of African Americans working in this space, and that sometimes it's easier for patients if they are seeing someone that looks like them. If you don't have that, you can have authentic relationships with people, because when I've all these years that I've been in my career, and especially when I was working with patients, I was in the minority and my patients were in the majority in terms of most of my patients were white. And there wasn't a hindrance because of that respect and that mutual love for the patients. And they're realizing that, there wasn't a sense of, well, does this nurse really knows what she's doing and she doesn't look like me? So you can overcome that, but I really would love to see more African Americans and people of color in the field, end of life care space. We don't have as many as we could. So when we talk about working with diverse communities, we don't have the field staff out there that matches the community from the organizational perspective, if that makes sense.
Well, I know we only have about 2 minutes left. Marisette, I wanted to shift just for a moment and just
Yes.
ask you to share something that I really admire that South Carolina has done. And that is how you have managed to get the governor to declare April as National Healthcare Decisions Month. Uh, so
Yes. Yes.
impressive, and something that I think we should try here in North Carolina
Mhm.
to do as well. Do you mind just in the next minute or two just sharing kind of the
Yes.
steps and how that came to be?
Oh, yeah, that's something that we've done for many years now. First of all, we know the person in the governor's office that sort of handles the proclamations. And so our one of our members works with the bar. Cindy Coker works with the South Carolina Bar, and she typically initiates that communication with the governor's office. And so every year we have a proclamation. And for South Carolina, we just don't do one day, we do the whole month. So the governor proclaims that April is South Carolina Healthcare Decisions Month. That allows for our, and Laurie's on from Roper, but it allows for our health systems and others to really promote programs the entire month of April. So we just don't focus just on that one day. In our state, we've just seen some amazing things that happen where people will have like a weekend celebration around Healthcare Decisions Day. I just did something this week with the Parish and Community Faith Nurses Association around this month. So we try to do a lot of things during this month. But the governor's office is really open to that kind of public awareness and education. We also do the same thing for Hospice and Palliative Care Month, where the governor will make a proclamation for that as well. And so typically I would send that out myself from the Carolina Center, but that could be something that could be done also from the coalition. And we'll be doing that this year as well. So as we're doing our work with that, but truly something that's sort of a public awareness campaign. And in addition to that, we put together some communication pieces that we send out to the health systems. And we also have on our website just really underscoring the need for advanced care planning and actually challenging people to take the pledge. We have an advanced care planning pledge that we do during this month. And so encouraging people to either have a conversation, execute a document, those kinds of things during this time. So And I think that that's really cool too. We're doing quite a few of those things in terms of challenging us individually or organizationally to do some things. We've also seen where organizations have actually done some things with their insurance plans where the employees are able to get, health points for executing a document. And so that's something that the South Carolina Hospital Association was able to put in their health plan for their employees. So there are a lot of creative things that can be done. So I'll pause because our time is
I
up.
know it. I hate that it's up. This has been fantastic. There's never enough time. Marisette, thank you so much for coming today, sharing this excellent work that's being done. Hope that we know you'll continue to keep us updated on it because you're here with us. And,
Yeah.
just thank you, thank you, thank you.
Oh, you're welcome. I'll see my friends in the ACP work,
That's
the
right.
work group soon.
All right, everyone. We'll have a fantastic weekend.
All right, guys. Bye bye.